Welcome to the Lifestyle First podcast, discussing lifestyle medicine and making self-care as easy as 1, 2, 3. One question, 2 research reviews, and 3 actionable health tips, all centered around the Lifestyle First method, your blueprint for the 10 key routes of optimal health and happiness. And now your host, lifestyle medicine physician and coach, Dr. Alka Patel.
Welcome to Series 3, Episode 4. This week's theme in the Lifestyle First method is E, exercise. So, the one question we'll be answering is, how can you exercise your way out of pain? Now, pain can be such a strong feeling, such a strong sensation, and it's a universal feeling. We'll all have experienced it in our lifetimes. It can halt you in your tracks though, can't it? Stop you doing things you want to do, stop you enjoying the things you want to enjoy. It also affects your mood. But there's often conflicting information about what to do when you experience pain, and in particular, musculoskeletal pain affecting your muscles or your joints. And the big conundrum is usually, should I move? Or should I keep still? Should I keep a joint mobile or should I rest it? What is the best way to speed up and aid recovery and minimize pain? So, the 2 pieces of information we'll be looking at to explore this are 2 research papers. The first in the journal Clinical Rehabilitation, looking at the effectiveness of strengthening or aerobic exercise on pain relief in people with knee arthritis. So asking, is exercise effective? And the second, a review in the journal asking if long-term physical activity is safe for older adults with knee pain. So, is exercise safe? So, to help explore today's question, how can you exercise your way out of pain? I am delighted to have with me Dr. Alex Maxwell. Dr. Maxwell, Alex, is a GP, a school doctor, a sports doctor, and a lifestyle medic. He's also London Director and Social Prescribing Director for the BSLM, as well as a Social Prescribing Clinical Director in Croydon. So, over to you, Alex. Welcome. And perhaps you could start by explaining what impact exercise has on musculoskeletal pain.
Great. Well, thanks for having me, Alka. So I wanted to talk about a very common topic that I see in my clinic. That is the topic of pain in joints in particular. And I wanted to focus today on the knee joint because it's a very common one. And how people are worried that exercising will damage them further or will make their pain worse. Now, I've found 2 really good quality studies and also wanted to talk around them, and we're going to have a chat about the topic, aren't we? About how it is safe and effective to exercise. And in particular, I wanted just to go over how best you can approach it and some of my top tips and tricks for how we can get the most out of exercising and to keep you happy and healthy and safe and effective exercising for the rest of your life.
That's brilliant, because I think the biggest thing that people don't want is pain. You know, it's a really, really kind of deep sensation and something that instills fear, I think, in a lot of people. And there's a lot of confounding information out there. Should I move it? Should I not move it? Should I do more? Should I do less? And ultimately, I think it's useful to know what is exactly, as you say, safe and effective, and ultimately what's going to reduce and get rid of that pain whilst the joint or the muscle itself is allowed to rehabilitate or repair. So what are your suggestions then? Is exercise actually safe when you have pain or musculoskeletal injury?
Yeah, so I think one of the things we need to address is the fact that often people are told that they need to rest. So when they injure themselves, one of the classic things to be told to do was to rest. And actually the current evidence suggests that even, so yes, there are some exceptions. You badly break your leg, you probably shouldn't go out for a walk straight away. But I say that facetiously. Actually, the point is that what you should do is you should move as much as you possibly can. And that may well be a lot less than you could either prior to the injury or prior to your condition. So focusing today, because injuries are, a fascinating topic, they're quite unique. The principles do overlap with what I wanted to talk about today, but I thought I'd focus a bit more on the longer term stuff. So in particular, knee arthritis and knee pain. So I think the first thing I wanted to say was, and in answer to your question, is it okay? Is exercise okay? Yes, it is safe and it is effective. So there's great evidence for all of that. And we just want to go through a little bit of the detail, a couple of little caveats, but in general, the take-home message is it is safe and it is effective.
Great. Okay, so give us a little bit more information about the kind of safety aspect of it, because again, for most people, the worry is, am I doing more damage than harm?
And on average, it's very unlikely that you'll damage yourself. Say, for example, with your knees, again, focusing on your knees, it'd be very unusual to actually damage yourself doing exercise. The only caveat to that is what I was talking about before, which is doing far more than you are capable of. Now, in the same way that if I went out and tried to do an Olympic athlete's training regime for a week, I would be in bits. I would probably injure myself. The same way that a lady who's done very little, she's 80, a man who's done very little, he's 65 and was badly injured when he was young and has done very little for 30 years. These people won't be able to do what I do on a day-to-day basis. So it is what your tissue can tolerate. And I use that phrase, tissue tolerance, i.e. what your body and what your tissues can cope with. And if you go beyond that, then they adapt positively and they like that. But if you go too far beyond that or go beyond it for too long, then they start to not be able to adapt quickly enough. And that's when you're a bit more likely to get hurt. So going back to arthritis, all the evidence suggests that, and we've got 2 great studies that demonstrate that it's safe and effective. I'll focus on safe first, that strengthening or endurance exercise, weight bearing or non-weight bearing, help with and do not damage your knees. Now, in a bit more detail, strengthening exercise is hard enough to make your muscles work and build strength. Aerobic exercise or endurance exercise makes you get out of breath. Both of them help. Weight bearing is when you're holding your own weight on your legs, and non-weight bearing is when you're either sitting down on a bike or a stool or something where you're not weight bearing. So all types of those exercises help with knee pain.
Perfect. And give us some examples then, Alex. What's the sort of things people can do in their own homes at the moment? Because getting to that gym is a bit more difficult. What can you do in your own home that's going to be weight bearing, non-weight bearing?
Yeah, and I guess there's so many different types that it's almost difficult to know, isn't it? But any single one of them is absolutely fine and is safe. So things that we can do at home, there's numerous. And if you do a quick Google, you can find so many online activities now. It's amazing, actually. COVID has really demonstrated our resourcefulness, isn't it? But there are great resources on the NHS website. There are YouTube things, even Joe Wicks. There are tutorials on how to use bands, and I would recommend them. Depends how much equipment you have at home. But a water jug, a couple of kilos, or even a pet or a child that you've got running about, if you can catch them, you can use them. Or anything you can find. You can fill up a rucksack with a few kilos, put it on your back, make it harder. And it's worth mentioning that you can make anything easier or harder. So if you're finding you're doing something and it's sore, and I generally say maybe 2 out of 5 pain is where you would try not to go beyond. And bearing in mind that has to be 2 out of 5 during and also not more than 2 out of 5 after. So if you look back on it and you think, now it's got me too sore, then that probably was a little bit too much. And what you can do to help it is you can slow the reps down. You can make the reps smaller. So you can do some air squats and you can sit back to a lower surface or a higher surface, and that makes it easier or harder. You can do more reps, fewer reps. You can do reps with more weight, reps with less weight. all of these variables that you can try and do to get yourself within your tissue tolerance, but just building it a little bit. And eventually what happens is your capacity to do things goes out, because the body's wonderful and it does recover, regenerate, and get more resilient if you do things to it. But the converse is also true. And if you rest, or you are fearful of doing things and you don't, your flexibility and strength will come in. And eventually you can be in a position where normal life, even though you don't have a direct injury, normal life can be sore. And that is why there is always something that you can do, and always something that can help you get out of pain.
So how does that fit in with duration? Because one of the big key things that comes up all the time is time, isn't it? It's how do I find the time to put in enough exercise that I'm going to make a difference? Is there a minimum duration? Is time our blocker? Should it be? How do we overcome that? What kind of minimum duration do you recommend?
So I think there's two factors in there, aren't there? So the first is being sedentary itself is what I would call a risk factor for disease, i.e., if you smoked a pack of cigarettes and then went on for a jog, you wouldn't stop or negate the fact that you'd smoked a pack of cigarettes. Well, the same is true for sitting all day. And I know we're both sitting down, but we'll get up after this. If you sit down all day and then exercise even for 10 minutes, that exercise is beneficial, but the fact that you sat for that amount of time is also a risk factor or can cause harm. So the first thing is, well, the minimum amount of exercise that you can do, well, if you do 0, even getting up would be beneficial. So although we might not have the evidence for 0 movement to 10 seconds of movement, I would suggest that there isn't a classical minimum amount of exercise that is beneficial. But if we were to really try and quantify a little bit, probably getting up for a minute every hour, or maybe 2 minutes just to get up, move around, shake it off a little bit would be beneficial and prevent you being as sedentary as if you were just sitting there for the whole time.
Yeah.
So that's the first thing.
Completely agree. What about focused exercise then, in terms of a minute of focused exercise? Is that good enough to beat that pain?
Yeah, so then we're thinking, again, relative to your tissue tolerance, if you've been doing nothing, doing a minute of leg extensions, where you sit down and you raise your foot up and down, that actually is quite likely to help your knee pain. Again, I make very specific recommendations to the person in front of me, but it is a general rule, that 2 out of 5 pain rule, so don't do something that makes it worse than 2 out of 5, and you can always find something, and don't do it so that it made you more than 2 out of 5 pain. Now, bearing in mind, that's not muscle soreness, that's not DOMS, yes. And that can be more than 2 out of 5, but actually muscle soreness necessarily isn't a problem. It isn't directly associated, and you shouldn't chase muscle pain, but it isn't the same as a joint pain. That's discomfort, I would call it, discomfort. Yeah. And knowing the difference between those two and being reassured that you're not damaging yourself if you are experiencing a little bit of discomfort is quite reassuring, I think people find.
Yeah, no, definitely. So there seems to be consensus that exercise is safe if you're in pain. And then you were talking about effectiveness as well. So does exercise reduce the duration of the pain, the overall duration that you have to sustain and tolerate pain for? Is it effective?
Yes. So pain is well understood to be reduced by most types of exercise. Again, as long as they don't go outside of your tissue tolerance, you don't go out and do a million jumps or, high impact stuff when you're not used to it. There's nothing wrong with running, for example. Running doesn't cause osteoarthritis, running with good technique especially, but running with bad technique or running beyond your capability on hard surfaces, lots of big jarring impacts, may well cause problems. It doesn't directly necessarily cause arthritis, but if you can't control your joint, every landing that you're doing, then you probably need to rein it in a little bit until you can, and you can build up to it. And actually, the evidence suggests that running and weight-bearing exercise is good for your joints. So this study that I've got that we'll put up is a great study that demonstrates that all types of exercise, strengthening or endurance, as well as weight bearing and non-weight bearing all help your pain. So they are effective at reducing pain. And I think we have to remember that. So you basically can just do anything as long as it's not really, and I think people are sensible enough to know that they shouldn't go out and do 100, pogo stick jumps on their right leg. Then you will end up helping your pain because you're going to improve your strength. And that's probably the most effective thing to do.
Yeah, I think that's all really reassuring, isn't it? Is actually you're not going to do any harm. You're actually going to do good because it's effective, and you're staying within your safety limits because you're in tune with your own feelings and your own sensations. And I think that's key, isn't it? Is just tuning in with your own senses, and you'll know when enough is enough or too much has been too much, and just kind of keeping really mindful of that. So no, brilliant. Thank you for that.
And now here is your Lifestyle First prescription. Your 3 activating actions to take you from knowing to doing.
What I wanted, Alex, was to ask you if you could give 3 top health actions today that people can take on board. Go for it.
Thanks. Yeah. So I was thinking about this and trying to make it as evidence-based as possible, but also as relevant and applicable as possible. So the first one is enjoy it. We always talk about exercises. Well, I often talk about exercise with my patients, and there are a lot of barriers. It's very challenging, and people are worried about it and fearful about it, as we've talked about before. The very effective way to reduce your fear, your embarrassment, your worry, and increase your likelihood of doing it is to do something you enjoy. So go and play badminton with your friends, socially distanced, of course, at the moment, but in general, I'm sure we'll get past COVID at some point. Go and play table tennis in the park. Go for a walk with your friend. Go on a bike ride. Remember when you were a kid and you really enjoyed playing it or tag? Go and do something that you enjoy doing. Don't make it hard work. Don't call it exercise. Call it moving. There's a lot more things than just, going to the gym, pumping weights, or having to have a miserable, we talked about burpees before we started this, didn't we? Having a miserable time doing 100 burpees. Well, if you don't find them fun, don't do it.
Yeah.
That's fine. Go and find something that you enjoy. So enjoy it is my first tip.
Thank you. And I think enjoyment, it's so key. And actually enjoyment is often linked to a memory, isn't it? If you go back to a memory of when you had that hula hoop out or that skipping rope out, that's the stuff you did enjoy. So hark back to that time. Yeah, no, love that. Next tip, Alex.
Yeah, go and play. Have a great time. And you know what? Suddenly your heart rate's up, you're having a brilliant time, you're forgetting about things and you're really enjoying it. And actually there's nothing more functional than play. So I would definitely suggest that. My second tip is, we were talking about, is there a certain amount? Well, I think my main tip is to say that a little something is better than nothing. And you can always build it up later, right? But if you do a little something, you should be very proud of it if it's a little bit more than it was before. Nothing wrong with just doing a little something.
Great. And then those kind of small microscopic increments can really be effective, can't they? So yeah, start with little. Brilliant.
So don't put barriers up thinking that you've got to put the perfect outfit on, go to the perfect place and do an hour and a half or 2 hours. Just do, in the middle of say you're watching TV or on the computer, put a timer, a minute, and just stand up and sit down just for a minute. I do this in clinic all the time. I'm sure you do as well. I mean, just do a little jiffle about, do a dance if no one's watching, or if they are, just do a little something.
Yeah.
And you feel so much better.
Yeah, no, it's so true. This desk, I know we're both sitting, you said, but this desk that I'm at is actually a stand-up desk. And so I actually do stand up, and then it allows you so much more freedom of movement, doesn't it? And that minute, as you say, it's just so easy to then move or stand on one leg even, or, do 10 squats. It's easily done. But that minute is what gets you going. I love that. Brilliant. Yeah. And third tip, Alex.
And then thirdly, so my last one is keep going. All of the literature suggests that. And also this is a common thing that I see in clinic a lot, which is, I did physiotherapy. I tried physiotherapy and it didn't work. So often what that means is, if you delve into it, is they often didn't do the exercises necessarily. And B, they didn't do them for long enough to see any effect. So if you've had knee pain or back pain, say, for example, for 10 years, doing 2 months of physiotherapy, and let's get into it, your bottom muscles and your core muscles aren't very strong, but your muscles are quite stiff because they're worried and a bit fearful about damage. Doing two months of once a week exercises or a couple of times a week exercises objectively is not going to have made much difference to your tissue tolerance, right? And if that's been gradually coming in over the last 10 years, doing a few exercises isn't going to have made that much difference. Now, we can find the best ones and we can do them as effectively as possible and as safely as possible. But the fact of the matter is, change takes time. And I ask people to give themselves the respect to treat themselves like athletes. And actually, athletes work on Olympic cycles. They work on yearly cycles or seasons. They don't work over a couple of months, because Usain Bolt wouldn't be much quicker after a couple of months. Well, neither are you. And that's absolutely fine. So my number 3 top tip is consistency is key. Keep going. It will get better, I promise. And all the evidence supports that.
Yeah, I think that's great. I think there's this sort of honeymoon phase, isn't there, when you start something with that enthuse and it's something you enjoy and you start with a little bit, and then for whatever reason that honeymoon phase kind of ebbs away, either because you're probably not seeing what you want to see in that kind of space or time and you let it go. But actually perseverance is when you would have seen the effective benefit of what you're doing. So love that. Just start, enjoy it, and keep going. Brilliant. Yeah. So Alex, we're coming to the end now. So if listeners want to get in touch with you, find out more, how can they do that?
Of course. So I think the easiest way to contact me is to email me. I am at alex.maxwell@melioramedicalgroup.co.uk, and we can put that up. And also the website for my company is www.melioramedicalgroup.co.uk.
Perfect. So we'll definitely get that info up on my website, and some of those resources as well that you've been referring to as well. So leaves me to just say thank you so much, and I really hope everyone has enjoyed today's insight as much as I have. Thank you, Alex.
Thanks very much, Alka.
Thanks for joining us on the Lifestyle First podcast, making self-care as easy as 1, 2, 3. Don't forget to subscribe and share, and we'd love it if you'd be kind enough to leave a review. To learn more or to arrange a consultation, please visit www.dralkapatel.com. See you next time.